So, hi everybody. Hopefully, everyone is doing good in the studies, in their everything is going good in the families, right? So, it's the end of your first semester, I know, but still, since আমি এটা এখনো পড়াইনি, I have not I have not talked about the bones of thorax, so এখন আমি এটা করছি, ঠিক আছে? Congrats for your first semester, right? আজকে কি পড়াবো আমি? I'll be showing you the first rib, okay, the first cervical rib. Okay, first of all, what are the parts of a rib, of a typical rib? ঠিক আছে, of a typical rib, what are the parts? First of all, there is the head. The head is this, okay. After that is the neck. Then you have the tubercle of the rib, and well, the tubercle is present at the angle of the rib. This is a characteristic of a first cervical rib, okay. So the tubercle is present at the angle of the rib. There is an angle of the rib. This is the angle, okay. Then you have the shaft, right? So these are the parts of the first cervical rib, of a typical intercostal rib also, ঠিক আছে? Just one characteristic is that at the angle of the rib there is the tubercle present, ठीक है? Right. Now how to do the site determination? See, we have to put it on a floor. Since I can't show the floor, just think that my hand is the floor. You have to put it on the floor and you have to show it. Like you have to show that the head of the rib and the anterior end of the rib both are at the same level, right? If you keep it like this, you will see the head is above the surface. It is not touching the floor, okay? So the side on which the rib, the head of the rib and the anterior end both are at the same place, are touching the floor, is the side of that rib. That is a side determination. Here I am holding the left first cervical rib. However, in your body, the rib is actually arranged like this. It's like this. The anterior end is a little bit at a lower level than your head, okay. The angle of the anterior end crosses your apex, mane the apex of the lung, okay. So the apex of the lung is present behind the anterior end, okay. So the head gets attached to the vertebra, the thoracic vertebra, okay. That's, I think, T1 and T2, I think so. I might be wrong, okay, but it attaches to the thoracic vertebra, okay. Now coming to the relations of the neck, that is very important when you are studying the first cervical rib, okay. কি আছে? From medial to lateral we have the sympathetic trunk, okay. Then you have the first posterior intercostal vein, okay. Then you have the superior intercostal artery. Then you have the ascending branch of the ventral ramus of first thoracic nerve. কি বললাম? This is the exact words you have to use. The ascending branch of the ventral ramus of the first thoracic nerve, T1, right? This is the thing you have to say, from medial to lateral. These are the exact words, the key words you have to use, right? Then you have the tubercle. The tubercle gives attachment, it attaches to the transverse process of the thoracic vertebra. Okay, first thoracic vertebra, right? Okay, this part is done. First of all, talking about the entire rib, it has an upper superior surface, a lower inferior surface, an inner end and an outer end. Okay, that is the shaft. Not talking about the rib, the shaft, the body, the shaft. Okay, the shaft. The entire shaft of the rib has a superior surface, an inferior surface, an inner and an outer border. The inner border entirely gives attachment to the suprapleural membrane or the Simpson's fascia. Okay, then you have the outer surface. The outer surface in the middle portion gives attachment to the first digitation of the serratus anterior muscle. First digitation of the serratus anterior muscle. Okay, right. Come to the superior surface, another very important thing. In the superior surface, you will see an anterior, you will see two oblique grooves. Okay, two oblique grooves. One is the anterior one, the other is the posterior. Okay, the anterior oblique groove, through the anterior oblique groove runs the subclavian vein. In front of the subclavian vein, you have, in this portion, you have the costoclavicular ligament, and then you have the subclavius, right? You have the subclavius. Okay, now between the anterior oblique groove and the posterior oblique groove, you have a tubercle which separates the two grooves. This is scalene tubercle, gives attachment to which muscle? The scalenus anterior muscle. The scalenus anterior muscle. Okay, now coming further behind, in the posterior oblique groove runs the subclavian artery and the lower trunk of the brachial plexus. The lower trunk of the brachial plexus. Ki hoy? The ascending branch of the ventral ramus of first thoracic nerve attaches to the brachial plexus. Okay, to the C8. Okay, the C8 portion, the C8 part of the brachial plexus, and forms the lower trunk of the brachial plexus. So both the subclavian artery and the lower trunk of the brachial plexus pass through the posterior oblique groove. This is the thing. And just behind, okay, just behind the posterior oblique groove is present the scalenus medius muscle, right? The scalenus medius muscle. Okay, so this is the thing regarding the superior surface. Okay, now coming to the inferior surface. See, in the inferior surface, nothing, no groove is there. It is just flat, smooth, right? It's just flat and smooth. On the outer aspect, in the inferior surface is attached two muscles, intercostalis internus, intercostalis externus, but not intercostalis intimi muscle, right? This is the difference. Otherwise, in all the intercostal spaces, there is an intimi, okay, as the anterior boundary, but here only intercostalis internus and externus. Now on the inferior surface, the inferior surface is related obviously to the intercostal space and its contents. Here the contents are different. We know that the contents of the intercostal space is vein, artery, nerve. Here is just the reverse, nerve, artery, vein, nav, which is intercostal nerve, intercostal artery and intercostal vein. All these three structures lie in relation to the inferior surface, right? So this is the thing regarding the first cervical rib. I hope you have understood it. Okay. Next I'll be talking about the sternum. Okay, and I also have the typical intercostal rib. So see you in the next video.